Has your doctor ever stolen your medications that you've gotten at the pharmacy, and then the DA had to show up at your pharmacy because there was multiple reports about it? Today's PharmaTea is going to be crazy. That's why I'm just drinking water, because it's too much. Pretty much how it all started was that we had a patient that came into our pharmacy. This patient had gotten some prescriptions from our pharmacy because he was going to go upstairs for an appointment. The appointment was this provider that does surgeries in office. And this provider would write the same 3 prescriptions, one of them being oxycodone liquid. And these medications are meant to be taken post-op. The patient had just had a surgery, but he was looking at his oxycodone liquid bottle, and he noticed something was off, so he brought it down back to our pharmacy. He asked if he could compare it to the oxycodone liquid that we had, because he's taken oxycodone liquid before, and this looks a little lighter. Thought it was a weird request, but we were like, sure, let's see what's going on. When we poured his liquid and compared it to our liquid that we had given him, it was lighter. So we asked the patient, did you add water to it? Were you trying just to dilute it a little bit? The patient said no. He said what had happened was when he came up for his surgery, the nurse had taken his medications that he had gotten from the pharmacy and went out of the room. He said that the nurse said that the provider just wants to make sure he got the correct medication. And then after the surgery, the patient was given the medications that they had come up with before the surgery. And that's when he noticed the liquid was a different color than before. So the patient actually filed a complaint with the DEA. And then they started their investigation. So this incident happened a couple years ago, so I don't know if it's still an active investigation, so I'm just going to be very brief about what kind of happened. When the nurse took the medications prior to the surgery, they were pouring half of it into another bottle, and then filling it up back with water and giving it to the patient. Then the provider and the nurse would stockpile this and sell it. What's crazy is that the pharmacy I worked at had been working with this provider for years. Our pharmacy had no idea that that was going on. This is just a really important PSA that if you have to bring medications to an appointment and the provider takes it, especially if it's a liquid, make sure that you look at it and compare it when you get it back. And that's the tea.